Well, hello everyone. Welcome back. This is my 8 days of 10 days YouTube live. And today's session we're going to cover introduction of US healthcare systems or IMG. So before we start, I just want to remind you that I have two gifts. The first gift is the USMLE Test Taking Strategies, which is available for free. I originally created myself after thousands of hours teaching USMLE. And I posted this back in FDN Forum 2017, and it has helped a lot of people to achieve high score. And I figured I'll make a video version of it. And here you go. You can enjoy the video version of my test taking strategies for free. We have a general approach to USMLE questions, elimination strategies, how to answer 50-50, and time management strategies. I believe that if you learn and apply this technique, your score will boost instantly. And the second gift is USCE Essentials Guide for IMG, which is also available for free in my website. It covers all the things that you need to know about the USCE. Again, it's free. Just grab it while you can. And I probably in the future I'm gonna add some more stuff in the USC Essentials Guide. All right, so let's get started. So today's topic: introduction to U.S. healthcare system for IMG. So what do people mean when they have done the first year of residency and they said, okay, now I understand the system. Now, when they say system here, they actually referring to the U.S. healthcare system. But what is the U.S. healthcare system all about? Now, US healthcare systems is not about insurance. Interestingly, when you Google, do YouTube US healthcare system explanation or simple explanation, things like that, they all talk about insurance. They talk about the Medicare, how the Medicare works, how the Medicaid works, the Medicare for 65 years old, Medicaid for people who cannot afford and has very low income, and then how's the reimbursement work, how's the way that is not important, at least for your purpose. That's probably important for people who work as social worker or case manager or who works in insurance because they need to know how to make profit or make money or maintain the money. But you're not. You're a clinician, and therefore your goal is to take care of the patient. So what you need to understand about U.S. healthcare system is how to navigate patient within the U.S. healthcare system. And in order for you to understand and able to navigate the patient care within US healthcare system, what you need to understand is resources. It's all about understanding resources. What resource you have in the US that you can use and utilize to help patients to cure, to manage, to comfort, etc. So, you can actually group the US healthcare resources into two: inpatient, outpatients. Makes sense, right? And we can group the type of resources into three types of resource: the human resources, so that's going to be the humans, right? The facilities resources, which would be a physical place, and the third one is the agencies or groups. So before we use patient example, I want to give you example. Let's start to think about some example of the resources. Let's talk about the inpatient resources and human resources. So human resource in inpatient settings. Who are those going to be? It's going to be the doctors, right? We call the internal medicine doctors there as hospitalists. We have specialists, cardiologists, gastroenterologists. These are clinical. And you might think, yeah, that's kind of obvious. But there are more resources in the US healthcare system in the clinical settings in the inpatient. For example, we have clinical pharmacists, we have respiratory therapists, we have physical therapists in house, occupational therapists in house, we have speech therapists in house. This is a high resource country. So there are more that actually US has to offer for patient care. Now, what about non-clinical and human in inpatient? We have social workers, we have case managers, we have, well, crisis workers would be considered as clinical because they see patients. Clinical pharmacists also sees patients, but they're kind of in between. So Those are example of human resources, right? What about facilities? For facilities, inpatient, some of the example would be emergency room, right? ICU. If you are in a specific specialty like an OB-GYN, that would be a labor and delivery unit. Okay. There are floors. There is a PACU, which is the post anesthesia unit. If you are if you're a pediatrician, then you have a NICU, which is neonatal, PICU, which is pediatric ICU, and so on. So that's the physical place. Then you get it now. And what about the agencies or groups? Well, typically this would be something like adult protective service. So if you study USMLE, you're probably already familiar with some of this adult protective service, child protective services, and also insurance company kind of counts of the agencies. They are still really part of the U.S. healthcare system. So those are inpatients. Outpatients very similar, but there are some more extra. For example, like for facilities, we have retail pharmacy. Those are resources, right? We have for agencies, we have durable medical equipment. These are resources. They provide medical equipment to patients. Like for example, the sleep, right? The CPAP. I was referring to CPAP. The CPAP machines, the oxygen tanks. So these were provided by durable medical equipment. Those are agencies, right? So these are a couple examples. See, there are actually a lot of them. There's no way I can cover them all one by one and explain to you. But the idea is, if you understand, if you know what they are and understand their role, you'll be able to navigate patient care, and you then understand how the U.S. healthcare system works. Now, let's use patient example. So we're going to use a patient here, a scenario, and we're going to see how the healthcare resources within the U.S. healthcare system works together to lead for patient care, right? So a 79-year-old male presented to the emergency department after falling at home in the shower. He was brought in by EMS as he had been missing for about 2 days. He was found inside his bathtub by his neighbor. You probably still know how silly it is. Well, this happens. He eventually stated that he had fallen in the shower and had been unable to get himself up for 2 days. On physical exam in the ED, it was evident that his right leg was edematous, and ultrasound was done. Was not shown any DVT, but he was found to have high CK, so they diagnosed him to have rhabdomyolysis. But at the same time, because of high white count, they presume infection, of course, right? So antibiotics was started. Now, the blood culture came back positive for staph and group strep, so infectious disease, call it ID, is consulted, and the infectious disease team recommended antibiotics. That's in this case ampicillin, vancomycin. And throughout this hospital course, the patient also received Lasix because of leg swelling. They think there could be some contribution from congestive heart failure. The edema did not resolve at that time, not immediately, at least. He also developed AFib with RVR during the admission, so he was placed on cardizem drip. Cardizem is Deltizem, sorry, brand name, and Eliquis, also brand name, but that's an apixaban. So his right leg edema then managed with an ACE wrap. He received physical therapy, occupational therapy in-house. Case manager was involved in the case because the patient lived alone. Like if he doesn't live alone, he won't end up staying in the bathtub for 2 days. So he had no support at that moment. Physical therapy recommends stay in a rehab facility. Then patient's condition stabilized, discharged to the rehab facility. During the rehab, patient was seen by the PT, physical therapist, occupational therapist, speech therapist, and physiatry. Overall, his condition improved. He's stronger, and he was discharged 2.5 weeks later. And fortunately for him, his ex-wife stepped up and was able to care for him and take him to the place. And then he followed up with a primary care provider. And the right leg remained swollen, but there was no signs of infection. White count was normal. PCP referred him to cardiology for his AFib and heart failure, and infectious disease for the antibiotic course. And recommendation for if there's any additional recommendation for antibiotics. Then the right leg was still swollen, so it was not due to infection. They figured that out, and the patient was referred to a physical therapy for outpatient physical therapy to a lymphedema clinic. Then he was seen by a visiting nurse and get more physical therapy, get stronger. And months later, the right leg swelling is significantly reduced. He was able to walk again, and he can, after months later, he can play golf again, which brought him great happiness. And then he was discharged from his ex-wife house, and he back lives independently. All right, so this was a great outcome for this patient. Was very happy for him. Now let's analyze the resource. Okay, let's see. So when he first came in, when he first came in, what happened? Is the neighbor that actually, luckily, he was found by his neighbor because he was missing for 2 days, and neighbor called EMS. So EMS would be the first resource that we use here, right? The EMS brought this patient to the emergency room. Now, the emergency room is the physical place of resource. He was seen by uh, the emergency department, the ER doctors, right? The ER doctors will stabilize this patient, stabilize the vitals, check all the basic labs. And because of the right leg swelling, of course, the first thought, okay, stay 2 days, right leg swelling, DVT, right? So they do the ultrasound, they cover with antibiotics, and they usually will consult hospitalists at that time to admit the patients. Then hospitalists see this patient and then put appropriate consult to whoever needed. I didn't mention it in the story here, but he was septic initially, so most likely he stayed for a couple of days in the ICU, depending on his vitals and depending on everything else, as you know. So maybe critical care doctors, intensivists was consulted, right? So we have critical care, we have ICU as the physical place, we have hospitalists, we have infectious disease as well. So these are the human resources that was involved. And then after he stabilized, usually he's gonna go to the floor, and he was found to have atrial fibrillation, right? Now, usually in this situation, patient will be transferred to a telemetry unit, which is the unit that has the remote EKG, so we can monitor his heart rhythm, 24/7. And then who was consulted? The cardiology. So another human resources was consulted, right? And then they decide on treatment for the heart failure and for the AFib and the anticoagulation. Now, once he got all stabilized, he got better, what happened? Well, physical therapy was consulted, right? That's another human resource there. It was consulted, physical therapy was consulted, and what they do, the role is to decide where the patient can be discharged to, which is he appropriate for home, is he ambulatory enough, or does he require strengthening, etc. Okay, so physical therapy was consulted. Then case manager also get involved because now we need to consider the insurance part of it, where he can go after this. I mean, even if the physical therapy recommend rehab, they still need to figure out where the insurance can, approve which rehab he can go to. So case manager was involved in that case. So that's another resource that happened. Then after figuring all this out, the patient's ultimately discharged to rehab. Now that is a physical place. And look, in the US, we have multiple discharge places. There is rehab, there is skilled nursing facility, nursing home, independent and senior living facility. We have LTAC, which is long-term acute care hospitals. So there's multiple. This is also a resource of facilities, so where the patient can go after the discharge. There's home too. You can just go home, right? But there's also home with a physical therapy or home with a visiting nurse. That's also an extra. Well, the place is actually your home, but it's an extra thing, extra resource that we can provide for the patients for a safe discharge. And I did mention he was discharged to the rehab facility. Once he discharged from rehab, what happened? Well, fortunately, in his case, his ex-wife stepped up and then take him and would like to care for him. And I guess they have really good relationship. Lucky for him. So the PCP, he was follow up with PCP, and PCP connect in the outpatient settings, connect to a different specialty. And he also referred the patients to a physical therapy or a lymph edema clinic to help for the right leg swelling to get a manual lymphatic massage. And that's actually what resolved the the swelling. After, of course, rule out the congestive heart failure, DVT, and infection that was not resolved. So, all right. So you see, there are a lot of how that resources interact. There's a human resources, facilities, agencies that's involved, right? So many humans resource involved in this case. As facilities would be the main thing here would be the rehab, and then as for the agency that's involved would be the visiting nurse. Now, that's only one cases. Okay. One cases and you learn, oh, apparently there's a rehab facility. Oh, apparently there is a visiting nurse. There is a place called lymphedema clinic. All right. And there is a floor called telemetry. So if you're an IMG, it might be foreign for you. But if you're an American grad student, yeah, of course I know telemetry. No, I mean actually that's quite advanced. There's not a lot of countries actually have telemetry. We don't actually have telemetry unit in Indonesia. So you see, so you learn a lot of new resources here with this one cases. There's so many other cases. Patients with drug abuse, the resource we're gonna use gonna be different. Drug abuse usually involve a social worker, case manager, a mental health facility, a psychiatry, and then there is a call line for suicide. You see, these are resources. Patient with dementia, where we have to discharge to a nursing home. And it would be different how we navigate that if they are inpatient or outpatient and slowly deteriorating. Patient that is estranged from family who has nobody and then stuck in the ICU because some form of respiratory failure, looking for the social worker needs to step up, case manager needs to step up to look for guardian. Or well, we'll start from the family. Actually, I'm gonna try to find a family that maybe wants to step up, like the previous case, the ex-wife step up to take care of her ex-husband. Patient with strong mental health problems, like the suicidal ideation, homicide, immigrants then unable to speak English, the illegal immigrants because their resource gonna be limited. They don't have Medicaid, they don't have Medicare because you need the insurance to actually cover a stay in a rehab or some sort. They don't have the access for rehab, and we need to figure out how we can, help them with the help the social worker. We need to be consulted. Homeless patients. So another facilities, resource facility will be a homeless shelter actually. Abuse cases where adult protective service will be involved, or if it's a child case, then the child protective service will be involved. And how are we gonna involve that? Surgical cases which requires a lot of care if there is a wound and non-healed wound, and so many other cases. Now, my plan is, as I mentioned to you, that in last week I mentioned in my USCE lecture that I plan to create a USCE masterclass. I plan to actually put my dream is 100 cases of these. And if you're able to practice and read and then analyze the resources that you need to use for 100 patient cases, I think you're going to be very, very comfortable in the US healthcare system. But when you come in, you're not going to be like when I start my USCE. This patient goes to LTech and I say, huh? What's that? You know? So you know that there is a place called LTech. If somebody is intubated, cannot be extubated, they put on the trach, you can go to long-term care, acute care, hospitals. You see, if you have seen 100 cases, and that's what the intern has done, for the whole year, they've seen one cases after another, and they start to open up, oh, there is this resource. Apparently there is that resource. Apparently there is a transplant team. Apparently there is this durable medical equipment. There is an Alcoholic Anonymous. So if you already know ahead during before you jump to USCE, you'll be very, very comfortable, and you can really focus on impressing the preceptors and get a good letter of recommendations. All right, so that is coming. I plan to create it in the future. Now, that's it for today's. Well, I'm gonna put the last word here. The idea is, again, if you understand the role of the resources, you should be able to navigate the patient care in the US. Right. So that's all for today. Thank you for tuning in, and I welcome any questions that you may have. Okay, so if you have any questions, you can put in the question in the comment below, and I'll make sure I jump in and answer any questions you have. And tomorrow would be the 9th day, so we're close to be done. Total 10 days. Tomorrow gonna be the 9th day, and tomorrow we're gonna talk about the ERAS and RMP. Have a good night, and I'll see you again tomorrow.